I think we all know that there is no quick fix for the problem of obesity. There are medications, pharmaceutical medications, that you can actually obtain under certain circumstances from your doctor or from private sources. Even they are not magic. They help and they support a sensible diet, a sensible plan with exercise and everything else, but they don't take over. They're not simply going to take the burden of responsibility from you. Take the pill and forget about it. That doesn't mean they're not useful. They can be extremely useful. You are talking to your doctor about this. But first, I'd like to introduce Dr. Matthew Capehorn from the National Obesity Forum, and he will run through currently available therapies. I'm Paul Stillman, and this is Streaming Well.
The National Institute for Clinical Excellence and the National Obesity Forum both recommend pharmacotherapy or medications as appropriate for patients who either haven't been successful with a weight management program based around lifestyle, exercise or nutrition advice, or are considered at that much risk of the comorbidities associated with obesity that they need to lose weight more rapidly. Orlistat is a type of medication called a lipase inhibitor, and it works by reducing the amount of fat that's absorbed into your body. About 1/3 of any fat that's put into your mouth in the form of the food that we eat is not absorbed or turned into calories. So if a patient is, previous to taking the medication, weight stable, then they cannot help but lose weight while taking the medications. Now, if they're eating a diet that's high in fat, then they will get adverse side effects. Now, these aren't a side effect of the medication, it's a side effect of their diet, and they should be counselled that whilst taking this medication, they should be eating a low-fat diet to reduce the risks. If a patient eats a low-fat diet, they won't really get many side effects at all. If they're a little bit naughty and they do eat a high-fat diet, they can expect some side effects that include potentially yellow diarrhea, bad painful flatulence, oily stools, or in extreme cases, a little bit of fecal incontinence. Recently, another pharmaceutical company has gained European license to actually sell a version of Orlistat in a slightly lower dose of 60 milligrams, but over the counter through the pharmacy setting. Now, although it's over the counter, it's not going to be a medication that can just be picked up, taken to a till and purchased. It's going to be purchased through a structured weight management program, just supervised by the pharmacist. But the advantage to the individual patient is that they don't necessarily have to see a GP to get a weight reducing drug. And this will be the first time that it's available over the counter in this way in the UK. Now, the way that this works is it acts centrally on parts of the brain to make you feel more full. Now, during the first few weeks that you're on it, there is a concern that your blood pressure may go higher, and so your GP may want to see you fortnightly to check your blood pressure and make sure that this remains under good control whilst on the medication.
So, prescribed drugs are clearly useful and they may form part of your plan. They don't replace diet and exercise, but they sit alongside it for some people as part of a comprehensive package. They're not a panacea, and they do, like all powerful drugs, have side effects. If you think that prescribed medication may help you, then discuss this with your doctor. Thanks for watching.